Hi, my name is Brittany Bloom. I'm a third-year PhD student in Global Public Health at the joint doctoral program between San Diego State University and UC San Diego. Today I'm really excited to share with you my research project entitled Let's Talk About Sex Education. Consent and Access to Comprehensive Sex Education Among University of California Students. Recently, you may have noticed that people are talking about sex education. There's even an entire Netflix show named after it. For many years, there have been arguments between conservative and liberal educators about the pros and cons of sex education. Research findings indicate that comprehensive sex education is protective against outcomes like early sexual debut, teenage pregnancy, and sexually transmitted infections. Sex education is crucial in protecting the health and well-being of youth globally. As the Me Too movement has grown and gained traction, people are paying more attention to the prevention of sexual assault, sexual violence, and harassment. In this new wave of violence prevention efforts, sex education is also being looked at as a tool to prevent sexual violence because it's associated with skill building for decision making and negotiation to help construct respectful and equitable relationships free of violence and sexual coercion. Sexual violence and harassment on university campuses is a huge problem. While both men and women will experience sexual violence during college, women are disproportionately impacted. And those who are part of marginalized groups, like our LGBTQ community, students of color, and students with disabilities, are even more likely to experience sexual violence and harassment. Experiencing sexual violence has negative impacts on students' health and leads to outcomes like anxiety, depression, and suicidality. It also impacts academic achievement, like lower GPA and even dropping out of college. We should do everything in our power to protect our youth from experiencing sexual violence. Therefore, additional research is needed to push the envelope on how formal and informal sex education can impact students, their relationships, and outcomes related to sexual violence and harassment. It may be no surprise to you that this work took place within university settings. My work was part of a parent grant entitled UC Speaks Up, which took place at 3 University of California campuses: UC San Diego, Los Angeles, and Santa Barbara. I traveled to all 3 campuses to interview undergraduate students. The Center for Community Solutions, our nonprofit collaborator in San Diego, is the only sexual assault and rape crisis center in San Diego, and they were a huge asset in training us to be survivor-centered while conducting this research. Between August and December 2019, 300 UC undergrads were recruited and asked to participate in a survey. Based on their responses, 59 students participated in an in-depth interview and were provided $25 and a sexual violence harassment resource guide specific to their community afterwards. I leaned on methodologies used in community-based participatory research, which engages the community as an equal partner in the research process. I hired undergraduate research interns from our 3 campuses, and they helped me finalize the in-depth interview and also recruit and interview students on their campuses. Briefly, our students ranged in age, gender, sexuality, and race ethnicity. We found that students received most of their sex education in formal settings. However, parents played a role in teaching in topics like relationships and sex and religion. Surprisingly, some students indicated they had never received sex education, formally or informally, on items such as violence, consent, or pleasure before entering into college. Others said that their only form of education on these topics was through the media, mainly pornography and the internet. Next, for our qualitative findings, we identified 2 key themes during preliminary data analysis. You'll see the quotes below. The first theme centers around consent and how important it is. Students believe that increased knowledge about consent could lower cases of sexual misconduct on and around campus. Another student shared that knowing more about consent allowed her to set personal boundaries without guilt or remorse and to feel safe. Our second theme touched on the importance of improving and expanding sex education, especially highlighting the need to include resource and help seeking within the curricula. Students belonging to the LGBTQ community specifically mentioned the importance of their identities being included in sex education and how its absence has negatively impacted them. In talking about our conclusions, I'm going to focus on the qualitative data, as it provided important perspective and insight into how sex ed impacts students. First, consent is important, and it helps students set boundaries for themselves. It provides them an opportunity to consider what they are comfortable doing in romantic and sexual relationships and what is off limits. Second, students indicated that improvements in sex education are needed and highlighted how important resource provision is. For example, when discussing sexual assault, rape, or coercion, providing tangible information on where to find help or resources if they have experienced sexual violence and harassment is key. This was especially true for LGBTQ students, who indicated that information about their sexualities, relationships, and or how violence might manifest within their relationships was never covered during sex education, which made many of them feel vulnerable and ill-prepared to combat stigma, coercion, and assault. If anything is taken away from this study, it's that too many students enter into college with limited sex education or no sex education at all. Colleges and universities are in a unique position to educate every student that walks onto their campus about sex education, reproductive health, and violence prevention. This includes consent, healthy relationships, sexuality, and available resources. This may reduce the prevalence of sexual assault and harassment and ultimately protect students within our academic institutions. This is just one solution, but one that could substantially help mitigate the high rates of sexual violence and harassment on college campuses. Last, I would like to offer a sincere thank you to the Western Regional Public Health Training Center. Without your support, I would not have been able to travel up and down the state of California to collect these interviews or pay for the transcriptions. I'd like to thank the educators and leadership of Dr. Jennifer Wagman and, of course, the Center for Community Solutions. I'd like to end with the most sincere gratitude to thank my undergraduate students who worked alongside me to complete this research.